Now we're going to turn it over to Dr. Paul Demers, who's the director of the Occupational Cancer Research Center and a senior scientist with Cancer Care Ontario, as well as a professor at the U of T Dalla Lana School of Public Health. He has a background in both industrial hygiene and epidemiology, and has worked with a number of international projects that look into occupational disease. And we're very lucky to have him with us here today, and looking forward to the presentation.
Thanks, Dave. Hi, everybody. Thanks for coming here today. I'm happy to be here and speak with you about this. I just thought I would start by saying that the Occupational Cancer Research Center is based at Ontario Health. Those of you who've known it for a while know we were based at Cancer Care Ontario, which was in the last few years has been totally absorbed into Ontario Health. And we're also funded by the Ministry of Labour, our Ministry of Labour Training and Skills Development, and the Canadian Cancer Society, as well as by organizations that fund specific studies. Sorry, this slide's a bit busier, and perhaps I could have shortened it down, but these were the objectives of our study as we were charged with it when it got funded by the WSIB originally. And you can even see this is the slide that I used when I presented it to the WSIB when I delivered the report some months ago. The first thing that we did when we started this study is to try, we wanted to make sure, because we had heard some concerns over time, that is the mining master file, and I'll talk about that in a little bit, but is that actually complete? And is the electronic version of it, the one that we use for research, actually complete? So we actually spent, while we were waiting for approval to do all of our linkages and proceed with the study, we actually had somebody go into the paper records that are held at the WSIB and choose up hundreds of records out of the paper records and make sure we could find them in the electronic records, and do the same thing in the opposite direction, and then check whether the information on those two sources of information were the same. And what it showed was, and what it reassured us was, that almost every record in the paper records we could find in the electronic records, and vice versa. So I think there were only of the 1,000 or so, I think we did 500 in either direction. There were only a couple of them that we had a difficult time finding when we were looking through. So we were pretty happy with that. During that period, we also went through the provincial archives and various historical records that we could find, including some that are held currently by our center that we got from the Ministry of Labour when they were trying to move some of their old files. We actually took those files and are now storing them at our center so that we can retrieve historical information out of them. Just trying to find whatever we could about the history of McIntyre powder use in Ontario. Now, what we found was actually very, very similar to what Janice and her group have found over time, but still we felt as though it's always good to take a careful look and see if there's any other additional information we could find. Conducted what's called electronic linkage, and then analyze that data. And I'll talk about those aspects of the study in more detail as we go along. Before I proceed, though, I wanted to say that this is really we got a good team working on this project. I'm I guess, the senior person on the team, which means the oldest person, the person who's been around the longest. But the folks who did, I believe, the most work are listed towards the top: Colin Berrio, Jill McLeod, and Xiaoke Zhang. And Xiaoke is actually attending the webinar here today, and she's doing her PhD work on neurologic disease in minors. And so she's actually written the paper on this that is that we hope will be accepted for publication very soon, as well as another paper that is accepted for publication, doing some other types of analyses, and there's several other things in the work that I'll mention at the end. And then the other scientists involved, Nate DeBono, Victoria Arundale, who's at U of T now, and Harris at Ryerson as well, also worked on this study. You've heard me mention the mining master file, and some of you will have heard of it. It is, I mean, now I think we think of it as being a computerized database of former miners. In fact, it's the computer version of the data that was collected on miners when they underwent their annual medical exams. Really starting in around 1927, these were exams being conducted because of the risk of silicosis, through around 1987. In 1988, they stopped collecting that information and mandating people, I think, do the annual exams, at least as part of that program. And the good thing for us now is that every year that people went in, they were asked, what did you do during the past year? What mine did you work at? And some other information. And for a number of those years, they also asked if you have been exposed to aluminum dust or McIntyre powder, which is the subject that we're going to talk about now. Over the many years that they were working on this file, and in 1951 they started to get the file actually organized, although initially in paper form. Over 93,000 Ontario miners had information on them collected in these files, and this has been used to do a lot of very important research on the health of miners over the years. And it really is the kind of research that drives change for miners. So it played a role. Well, certainly one of the earliest study that I can think of, the results of it led to a strike by the United Mine Workers in response to the hazards in uranium mining. The results of analyses done of the mining master file were used by the Ham Commission that had an important role in the history of health and safety in this province. So the mining master file has had a very important role that it's played in the past. I put this up, and this is from one of my center's earlier studies using this file, and it is actually from our work on uranium miners. And the reason I put it up there is that the mining master file can really help us learn the history of both the hazards that miners have faced over time, and as well the health impacts and the employment patterns that people have had. So in this graph here, which goes from 1954, when the first uranium mines were opened, till the mid-1990s, the red bars represent how many people were employed. The blue lines represents the levels of exposure to radon, which causes lung disease in the miners. And what you see here is different peaks of employment that have happened, and then thankfully the gradually reduced levels of radon exposure over time, particularly after a lot of ventilation was introduced in the mines and the Ham Commission in the mid-1970s. You can use this data from the mining master file to reconstruct the history of mining and really look at some of the health effects of things that have happened in the mine. So it's a very important for us. One reason that it really helps us is, I don't know if you noticed in the previous slide that there was a peak of people working early on in uranium mines, and then it went down and then went up again. Well, the first peak was for mining uranium for weapons purposes, and the second one was for nuclear power plants. But in between, people need to work somewhere else. So you're not ever, well, you're rarely just a uranium miner or just a gold miner or just a nickel miner. Oftentimes people switch between different types of mines. And what you see here is another graph here that says the number of miners in this mining master file who are employed in gold, nickel, copper mines, uranium mines, and other types. And the red bar represents the number of people who were only employed in gold, nickel, copper, uranium, and etc. But the blue is the people who actually, they were at some point employed in one of those types of mines, but moved to different types of mines. So many uranium miners, they might have gone to gold when those mines initially closed. When they reopened again, they could have gone back to uranium, and they could have gone to nickel mining. So people move around, and it's important to be able to really know where people worked and where they would have been exposed. And that's one thing that makes this particular data set very, very useful for us. I use the word linkage, and it's a term we use when we try to link a computer file. In our case, we had the mining master file, which I said had over 93,000 workers in it. Now, not everybody, because that's a lot of that file goes way back in time. A lot of people actually were already deceased. People who worked back in the 1920s by the time of the 1990s, when we wanted to include them in this study, or we didn't know what had happened to them. But we did try to link 38,000 of them to our hospitalization data for the province, our outpatient visit data, that is when people see their own physicians, ambulatory care visits, so different types of clinical visits. And we managed to link over 36,000, almost 37,000 workers successfully to that data. We excluded some women only because there were no women that we could identify that had been exposed to McIntyre powder, at least in the group that we were able to link. And there were no cases of neurologic disease. So there's no way we could really include them in the study. We still had a lot of people that we managed to include in this study, making it one of the biggest studies that's ever done, certainly the biggest study that's ever done on the effects of McIntyre powder. I won't spend a lot of time here. This is probably more for the physicians and researchers here, but we tried to look at Alzheimer's disease, Parkinson's, more specifically at Parkinson's disease, motor neuron disease, which many of you might not have actually heard of, ALS, which we commonly call Lou Gehrig's disease, and ALS is one of the types of motor neuron disease, and that's the reason we looked at motor neuron disease. So together, these are a bunch of different what we call neurodegenerative diseases, and they were all ones that had been raised by OCOW and by various physicians as ones that we should be looking at in relationship to McIntyre powder. This is the kind of history of where McIntyre powder was used in mines in Ontario by year. So all of that digging into those historic files allows us to really know which mines were using McIntyre, which ones were licensed by the McIntyre powder, the company that produced McIntyre powder, over time. And you see here that the number of mines kind of gradually gets bigger, jumps around a little bit with mines closing and opening. And as we get into the 70s, the numbers really start to drop. And then it really gets down to just a handful of mines towards the end. And at least in the records that we had, which were similar to what Janice talked about earlier, we didn't see mines continuing to use it after 1980s. So, but 51 different mines did use it over that time. Those numbers might be bigger if you included the unique names of mines, because sometimes mines change names over time. but we found 51 different unique mines. Now, we tried to look at McIntyre powder in two different ways. We didn't have a lot of independent information to go on, but what we did have was that in those actual mining master file records, there was a bit of a checkbox, and we're calling that self-reported McIntyre powder exposure. Workers were asked, did you use McIntyre powder? Were you exposed to aluminum dust? If they said yes, the box was supposed to be checked. What we did in what we called the primary exposure assessment was we assigned people as exposed for every year that that box was checked, unless those outside of 1943 to 1979, and that almost never happened. In fact, almost everybody who checked, I think there were almost no cases otherwise, although Janice said she's aware of one. I'm sure there might be a couple there. Most of those actually, this actually worked pretty well, and they even matched up in the correct mines. So that was one way we looked at things. The other way was, instead, we relied primarily on the historical records. So if somebody, because people were being forced to breathe in McIntyre powder before they went into the mines in the morning, we classified everybody as exposed to McIntyre powder if they were in an underground mining job or another job. Some of the other very dusty jobs were also required to breathe in McIntyre powder. And we counted all the years that McIntyre powder was used in those particular mines. So instead of relying upon a kind of check mark that was that was made when they came into the clinic, instead we relied upon the historic records, and that identified more people that were potentially exposed and more years that were potentially involved. 4 different diseases that we really focused in on, and we didn't end up doing much with LS or Lou Gehrig's disease. It's a terrible disease, but we just didn't have the numbers to be able to do much with that. Our agency and anybody doing health research these days is governed by very strict rules of privacy, and when the numbers get too small, the privacy regulations and the privacy officers in our agency and elsewhere don't allow us to report results because they're afraid it could breach somebody's privacy. So we're not allowed to do that, and we didn't in this case. So here's the 4 diseases that we looked at, and then we looked McIntyre powder either using the self-report or using the kind of historic records as our 2 different approaches. I'm just going to take a minute to explain this bit, and I hope that this is clear. This is what, basically our attempt to show the timeline. So what was happening over time. So the Ontario Silicosis Act back in the 1920s, the starting of the Mining Master File, which started in the late 1920s and then went until 1987, 88. The period of time when McIntyre powder was in use, 1943 to the late 1970s or even 1980, opening of uranium mines. You'll see there a change in McIntyre powder formulation. I'll talk about that in a little bit, and that's something that Andrew Zarnke and his colleagues reported in the paper that they had published, looking at how McIntyre powder may have changed over time. Now, a challenge is that what we wanted to use was we wanted to link everybody to medical records, and there are studies in the past that have looked at various health effects using death certificates. And that's handy because death certificates are computerized back to about 1950 here in Canada. You can link to those death certificates, you can go back a long ways. The problem is it doesn't catch everything. It says why people died, or at least what the physician who was at the hospital or elsewhere knew at the time of the person's death. And it could have missed a lot of neurologic diseases or not capture the kind of detail that we wanted. So for that reason, we decided to use medical records. And unfortunately, those only become available to us around 1992 and later. We have a lot better information than we would have had if we had used, let's say, death certificates, but we can only look at people who developed Parkinson's disease in the 1990s or after the year 2000. Talk about that in a little bit. It's a little bit, as you can see, there's gaps here because people were using McIntyre powder long ago. So if somebody developed a problem related to McIntyre powder, we may not catch it because we weren't able to catch diseases until later. On the other hand, as we're looking at neurologic diseases, those often happen later in life. And also, right now, we're at the end of that timeline. So people who may be looking for workers' compensation now, or in the last 20 years would be covered during that period. So there are advantages and disadvantages here, but I thought I would try to explain that. I mentioned that there are over 93,000 people in the full mining master file. And what you see here is the number of people in the mining master file by year. And when you look at those white bars, that's actually pretty close to the number of people involved in hard rock mining in Ontario over that period of time, because the mining master file was set up to look at silicosis. We didn't link our records until much later. Although we got the great majority of people who were employed at the later periods, who were miners or were exposed to McIntyre powder later, the fact is that there were people who were employed as miners long ago who we really didn't have a chance of catching because we couldn't link them to the computer records that we have today. So I just thought I would mention that again, and that's another limitation to this study. Here you see some of the most basic results. In that group of folks that we had 9,500 people who were exposed McIntyre powder using just that kind of self-reported, or those little check boxes in the thing, in those appointments when they were getting their chest x-rays and their annual lung exams. When we used our method, which used instead the assumption that anybody who was at a mine that required you to breathe in McIntyre powder would have, and maybe they didn't always report it, we actually get almost 14,000 people. But the results are almost the same. So in that top bolded, you see the number of people in those overall and in those two groups. And then below that, you see the number diagnosed with Alzheimer's disease, Parkinsonism, which includes Parkinson's disease, and motor neuron disease. You see the numbers are always bigger when we had more people classified as exposed, but the results, in fact, were almost the same. We really didn't find a lot of difference here. We didn't see a relationship between Alzheimer's disease or motor neuron disease and McIntyre powder. So our strongest relationship with Parkinson's disease, we saw over 30% increased risk. And we see something as well with Parkinsonism. The thing is that when you remove the Parkinson's disease, you don't see much at all for Parkinsonism. So all of that, what looks like an increased risk associated with Parkinsonism, is really just due to the Parkinson's disease, people with Parkinson's disease who are in that group. I'm not going to speak that much, but you'll see that as we go along, that because Parkinson's disease is elevated, it kind of drags up any kind of Parkinsonism. And Parkinsonism is basically a broader category that includes people who have similar types of symptoms to people who have Parkinson's disease, but don't have that more specific diagnosis by a physician. This is another way of presenting this result. You just see, when I should have said, I'm sorry, I'm going to go back here. The RR here is what we call relative risk of 1, means that the two groups are the same or have the same risk. People who are exposed or unexposed would have no difference. So when you see 0.96, that means the two groups were very close to each other. When you see 1.19, that means that the people who were exposed had a, let's say, 19% higher risk of disease, or in the case of Parkinson's disease, a 34% higher risk. The thing you see there in parentheses are what we call the 95% confidence intervals. That's our statistical testing, basically, to say how certain we are that this isn't just some kind of random effect, but that in fact it is more likely to be real. This is just presenting that same information in exactly the same way, and where you see that the results are pretty similar. The kind of bar, that little black line that goes left to right, that's the 95% confidence limit. The red symbol there is using that kind of self-reported. The blue one is using the historical records. We see results that are very similar for the two of them, but that line, that dashed line of 1 means the two groups are, it's the point where the two groups are not, there's really not much difference between them. In the case of motor neuron disease, the risk looked a little less, but if you look at that black line, you know that the numbers were very small. So the clearest effect here was for Parkinson's disease. You remember that change, or hopefully you remember when I was showing you the timeline and it said a change in formulation. There was a change in formulation of how McIntyre powder was made in 1956. If you have any questions about that, you can ask Andrew, because I think he's attending, and because he'll know more about it than I do. But the effect of that change is that we think the powder got to be a lot finer. And we know that the finer a powder is, when you inhale it into your lungs, the more likely is that it can pass through your lungs and enter into your body and cause health effects. So we worry a lot more the more fine a powder is, or the smaller those little particles are, because they can pass through the lungs. And in the case of some of these metals, may even enter the systems through the nose. So we're really whether that made a difference. And what we see here is that we see a stronger effect for people who were exposed after 1956, especially for the people with Parkinson's disease, and that's the disease that we're seeing overall, and you don't see anything for the other, for Alzheimer's or motor neuron disease. So again, another thing that says maybe this is this relationship between Parkinson's disease and exposure to McIntyre powder is real. We tried to look at how many years people had been inhaling McIntyre powder to see if that increased the risk. And what you see here is, again, we're plotting relative risks here. The dashed line going across is that line of 1, which basically says above that is an increased risk, below that there's not. We see things go up with Alzheimer's, but it never really goes much above 1. Parkinson's disease, they're all above 1, and then motor neuron, it jumps around. But again, remember, those are very small numbers that are there. So this is going on self-reported exposure, and this is going on exposure using historical records. So remember, this captures more people, but an important thing to know is that sometimes people came in and one year they might say, yes, I was exposed to McIntyre powder, and maybe the next year they didn't, or maybe they did and somebody forgot to check the box. It was a long time ago. We don't know exactly what happened. By using the historical records approach, I think we're capturing more of the years that people might have been there. And what we see here is a clear picture of the risk of Parkinson's disease being higher the longer or the more years people were used the McIntyre powder. Now, something that we were asked to look at was, is there any difference between the different types of mining that people did? And here again, you see the four types of neurologic disease we looked at, and whether you worked in a gold mine, nickel copper mine, or uranium mine. And what you see here is the increased risk. The little star means it's a statistically significant excess. Again, Parkinson's disease is driving those Parkinson's numbers. So if you remove the people who actually have Parkinson's disease, that bar would drop down close to the 1.0. But we did see more of an impact in gold miners. A thing to remember is that the gold mining in this particular file has the longest history in the file. And so we think this was due to the fact that these folks were older and had more of a chance to develop disease. And so we didn't put a lot of weight in that. And in the end, I believe the Workers' Compensation Board, the WSIB, agreed. But I thought I would show you this because we are continuing to look at the different types of mining in the province and try to think of other potential causes of neurologic disease. Because remember, we've only seen Parkinson's disease here, and there are worries about Alzheimer's and different types of motor neuron disease. And we looked at duration, and again, it looks like you see something in gold here, but we didn't put a lot of weight in it. Now, this is not taking into consideration McIntyre powder at all. And what happens is, if we pulled out the people who were gold miners that had been exposed to McIntyre powder, you don't see much of anything. It really is the people who were exposed to McIntyre powder that's kind of behind this pattern. It's another reason that we didn't think it was just due to being a gold miner. Now, the last piece of results that I'm going to show you before I go to some conclusions here is that all those other analyses that we were doing, we were comparing miners that have been exposed to McIntyre powder, the folks who've been forced to breathe McIntyre powder before going in their mines, compared to other miners who had not had that. So those were the two groups we were comparing. I wanted to see how miners and McIntyre powder exposed miners compared to the general population, just to give us a little bit of an idea of, is there anything else going on here? And so what you see here, the green marks here, are the entire group of workers in the mining master file that we were able to link, regardless of whether they were exposed to McIntyre powder or not. The red ones were the people who reported, or what we call the self-reported McIntyre powder exposed people. The blue ones were that other group, which is the group based upon the historical records. The interesting thing to look at here is that overall, all the miners in our study had a 20% increased risk of Alzheimer's disease compared to the general population. Their rate of Alzheimer's disease was increased, but it wasn't related to McIntyre powder exposure because all those groups were relatively similar. You kind of see that. Now with Parkinson's disease, what you see is that the McIntyre powder exposed people have a higher risk of Parkinson's disease than the general population. So we're seeing, pretty well the same pattern that we see when we compared Parkinson's disease looking at miners compared to other miners. But the miners that were, overall, and probably the ones that weren't exposed to McIntyre powder didn't seem to have an increased risk at all for Parkinson's disease. For motor neuron disease, we see the opposite. And we see an increased risk of motor neuron disease overall in minors, but less so in the people exposed to McIntyre powder. So those are two of the questions that we have kind of remaining after the end of this study. What's going on with Alzheimer's disease? What's potentially going on with motor neuron disease? Are those things related to other things in mining? And so those remain things we hope to study in the future. So now I am near the conclusions of the study, and I'm looking forward to hearing your questions. This is the largest study of McIntyre exposed workers to date. Because of the nature of the study that we used historic records, we didn't have to pull people in to a lab or a clinic to get tested. We could actually use the historical records. It gives us the chance to really study tens of thousands of people at the same time, which is, I think, a very powerful way to look at things. Rather than looking at deaths from neurologic disease, as was done in one Australian study, we're actually able to look at neurologic disease using hospital records and things like that, or even visits to physicians. And so that's another important advantage to this study. Although we didn't have as much information on McIntyre powder exposure as we liked, it would have been great to say what the levels were and whether it was different in specific mines. We did have historic records that allow us to look at McIntyre powder in a different way, and I think better capture the number of years people had used McIntyre powder, been forced to be inhaling McIntyre powder. And we were able to compare miners to other miners as well as to the general public. And oftentimes we worry when we're comparing working population, because generally in order to get a job as a miner or other physically demanding job, you've got to be a pretty healthy, strong person in the first place. And so we expect miners to be healthier than the general population, at least if we don't take into account the different types of hazards they're exposed to at work. A disadvantage or limitation of this thing is that we were only able to look at neurologic disease from 1992 or later. That's just the records that are available. So anybody doing this study would have had to have faced the same kind of problem going forward. It's not possible to do this kind of study with records earlier than that. Even though we were very large, we weren't able to look at the risk of ALS. Part of that is that when we code ALS in our records, our electronic records, what they code is basically a small number of digits, or so it's not 4 digits like, I can't remember the exact ones, but 3033. Instead, it's 333. And that smaller detail didn't allow us to identify ALS in physicians' offices. That gave us smaller numbers. We didn't have tried to dig as much as we could through the historic records, but there really wasn't the kind of information to say what how the practices in using McIntyre powder were in all of the different mines, even though we know there was a lot of variability and that some mines are different than others. We couldn't do enough mines to be able to look at that in the data that we had. In this study, we weren't able to look at other causes of neurologic disease, such as diesel exhaust, radon, or even head injuries that have been associated in some cases with neurologic disease after people have head injuries. And so here you see our conclusions. And what I will do is, I think, stop and leave these up. And I don't know if people want to hit me with the questions. Remember, I can't, reading the chat while I'm doing this might be a bit difficult. I could probably do it, but then I would cover over the slides. So does somebody want to read me questions, or do you want to open up the mics for people who do have questions? By the way, thank you all for paying attention. I'm sure this wasn't the most exciting of presentations. I just wanted to go through things slowly to try to hope that people could understand what it is that we did.
Okay, thanks very much, Paul. Yes.
It was already answered as to why this was not used in nickel mines and copper mines in Sudbury, and that's basically because the crystalline silica content is much lower in that ore, and the reason that they were using McIntyre powder was in theory to prevent silicosis. So that one's been answered in the chat. We've already talked about the healthy worker effect in your presentation. There was a question about that. From T. Kadadi, given the rationale for using it in the first place, what was the risk of respiratory disease or diagnosed silicosis in the McIntyre powder treated group compared to all miners? And also, do you know if the lung cancer rates were different?
We don't know, and that would be an interesting thing to look at. Basically, we were trying to get through this study in a fairly limited time with a fairly limited staff to work with. And it certainly is something that we can look at. A challenge is that both gold miners and uranium miners, you do see a high risk of silicosis and lung cancer in both of them, probably associated with a combination for uranium miners of radon, and for both gold and uranium miners for crystalline silica exposure as well as diesel exhaust exposure. But it's probably something that we could look at. Would be an interesting question to look at. We just haven't had time to do it yet, but it is a very good question, one worthwhile to look at.
Definitely, that's something actually, just to explain to people, the study that you did was on neurological disease rates, and we certainly see a lot of respiratory and a lot of cancers and some cardiovascular as well. And we would love to see the same study that you did repeated with those kinds of health conditions, because we're seeing them showing up in our miners a lot. And there is that question of whether the McIntyre powder may have compromised the lung based on Andrew Zarnke's work with Health Canada, the finely ground aluminum dust, whether it overwhelmed the lung system because you get this big inhalation of fine and ultrafine particulate right before you go underground and then are exposed to all these other things. So you've kind of overwhelmed your lungs system. So we'd be very interested in knowing that question. Does the mining master file, this is from Ron Kilner to everyone, does the mining master file capture dates by each day of exposure or just reports from yearly testing? And is the mining master file accessible to each person? Was the company responsible to keep records of daily exposure for each individual?
Really was when people came in, they were asked about their previous year of work. And sometimes there's some dates in there, but certainly there's not days of exposure in there. The questions were pretty broad, like what job did you what mine did you have? What job did you work in that mine? Along those lines. They may have asked when you stopped working, when you started working, or when you switched mines, but that's about as far as it goes. The companies actually didn't have anything, and unless there's something that I don't know about, but all of this was based upon the miner having to go in for their annual physical, and then they were examined there. But the records aren't from the mine company. They were collected at the time of the person being examined from the worker themselves. That should reflect more of their experience was in the previous year, not what the company says.
Thanks. And to your question about Ron, is the mining master file accessible to each person? Each individual mine worker can apply for his or her own mining master file record through a Freedom of Information request to the WSIB. We've sent in probably 500 of them in the last few years. And they can, if a person is deceased and they've been deceased for more than 30 years, then anyone can apply for that record as long as they have the worker's, basic information, usually including date of birth, date of death, and social insurance number. Usually have to provide a death certificate or something showing that they are deceased. If it's within the 30 years, then the executor of the estate can apply under compassionate reasons. And usually if they're involved with the McIntyre Powder project or needing that those records to show aluminum dust exposure that seems to have been accepted as a compassionate reason, so that they are accessible. The issue that Dr. Demers was talking about with respect to the self-reporting, just from the workers that I've spoke to, none of them report this sort of self-reporting of that they're the ones that said it on their annual chest x-rays, yes, I was exposed to aluminum dust. It was mandatory. So you knew that if you were an underground miner at McIntyre mine, you were exposed during that past year. So I think it was more of an automatic. That's just from the feedback that I'm getting. It does talk about being self-reported, but the feedback that I'm getting from every mine worker I've talked to is that it was just put in. So you would have a date that they had their annual chest x-ray, aluminum, yes or no. The next time that they went in for their annual chest x-ray, it may be a year later, maybe 2 years, if they couldn't, if they were off sick or something, they would again say, did you, was there aluminum dust, and it was checked off or not.
Wigmore, could I ask a question? So Paul, thanks for this, and Janice, thanks for what you did. A couple of things, Paul. I'm just thinking about what might have led to sort of more definitive results in some ways around some of this. So a couple of years ago, there was a big to-do about the use of statistical significance in a paper in Nature, I think it was, signed by, I don't know, hundreds and hundreds of folks. Questioned how the phrase statistical significance is used. And I think about people like David Kriebel, who taught me, and who sort of said, well, why are we using 95%? Why do we have to be 95% sure that this is all true, in quotes? And so I was thinking, so what if you were using you wanted to say be only 90% sure of the results. And if you combine that with the limits that there were because of only having access to medical records as of 92, because thinking about for how long the powder was used, who's being missed in all this in terms of, because some of these neurological diseases certainly take people's lives earlier than they might otherwise. So just thinking about both those things and how they contribute to the results that you got and what you might have seen if you'd come at things a different way or if you'd had access to those earlier medical records.
I actually have no idea what we would have found if we had access to those medical records. And I'm not, to be honest with you, I'm not the kind of person who likes to just speculate or guess in one direction or another. I don't draw my conclusions just based upon statistical significance, and there's these issues that were kind of born again recently, as you mentioned with David Kriebel. I mean, I did my PhD. These were an issue back in the 80s, or 90s. So they've been around for a long time. So I usually draw it on the basis of how much a risk is elevated, but it is helpful to kind of know when you're working with small numbers versus not, and how confident you can be in results. I'm not sure what we would find if it was earlier. It could be that there were some effects happen with McIntyre powder, happen, soon after people were there, and take a different kind of a study to find that. Somebody would have to go in and really look through people's medical records and things like that, and maybe interview some much older survivors. But it's kind of it was beyond me to do it in this particular.
Mm-hmm.
But I did just draw conclusions based upon statistical significance.
Yeah. So what you're saying here is essentially this is sort of like minimum that we can. This isn't necessarily all that was going on, but it had limitations.
Yeah, well, that's why I put out the limitations. I mean, there's always limitations in studies. There's always things that, we as a researcher, you get asked to study one thing, and oftentimes things arise that you really want to follow up and look at. And I think there's a lot of interesting things that would be look at here in terms of other potential causes of neurologic disease or other reasons for the patterns we're seeing. It just takes some more work to do those. But for sure, there are lots of questions that we still have.
Thank you for those questions. Just taking a look then, there was a question about explaining why this only studied cases from 1992 forward. I did answer that, but if you want to confirm, the database that you used that exists in Ontario started in 1992, so we couldn't do records before. That's correct?
Yeah, we didn't start computerizing. Computerizing our medical records or outpatient records in the records on patient visits with their physicians until 1991, 1992. So we only had 1992 forward available to us to work with. There's one or two provinces that I know that go start in the late 1980s, but it's just a fact of when we started computerizing all of our records.
Okay. There's some comments there just about the healthy worker effect a little bit. And then there's a question saying this is all about miners, but I'm interested in any records about other staff who went underground for any reason as well. When mine tours were done, did those people inhale McIntyre powder? I don't imagine that you have that answer, Paul. I do have some from talking with people.
Yeah, I don't, Janice. So you can take that. All we had were the people who were in the mining master files, and those were regular professional miners.
Okay, so I don't think that there are records of anyone being exposed other than the ones who were getting their annual chest x-rays. And in the mining master file, there were records from the McIntyre Research Foundation explaining which mines got the McIntyre powder and which didn't, an early record about that. And it did say, you know, if you were in the dry or if you were in the crusher, for the most part, you know, it would say whether you had McIntyre powder. I did speak to somebody who worked in the lab, I think, as a student, and when she went underground, she had to get it. Ministry of Labor mine inspectors were expected to inhale it in Elliott Lake. I've spoken to some of those. So yes, there are other people who were exposed to it that we may not have documentation that they were exposed to it. And the one thing on that Quirk 1 mill workers who worked in the crusher did get McIntyre powder, although it is not indicated on that form from the mining master record file from the McIntyre Research Foundation. A silly question, is there still an inventory of McIntyre powder, or did it have to be manufactured to be studied? So mine workers, when this was hauled out suddenly after being exposed to it for a lot of years, several of them took some of those canisters with them, and some of them have donated them to me and others. The unions had kept some, and so we did have some to actually analyze. So when Andrew Zarnke did his study, Dave Verma did a study as well, looking at the composition of McIntyre powder. They were actually looking at and analyzing canisters of McIntyre powder. Mind you, they were ones that had been sitting for 30-some years. So it's I'd encourage you to take a look at those studies if you're interested in that. Can the study be refined to look more closely at comparison with the general population, teasing out the healthy worker effect? There was a comment from T. Godotti earlier about that, just talking about initial bias versus retention bias for healthy worker effect, and that it would be the retention bias that it would be. T, I don't mean to speak for you, but that's what I understood from what you said in here. And T also had put in that in animal studies, the aluminum dust causes its own pneumoconiosis, which is dust produced lung disease, although less severe than silicosis and not documented in humans. It was called Shaver's disease. That's most of the questions. Let me just see. There's somebody here saying that he went on an underground tour about 3 years before working in the mine, and tour group never had to breathe in the McIntyre powder in that person's experience. And I think that's most of the questions. Oh, wait, what do McIntyre officials have to say about this treatment, or are they keeping quiet? So McIntyre mine itself is no longer operational. And most of the mining executives who brought this in are deceased. So yeah, I have heard almost boo from the mining industry since I started this. I had one person contacted me to say, things were bad in the past, but they're better now, and that was about the only outreach that we received. So I just want to throw it out then, since we have no more questions, and I looked on the Facebook feed, I don't see any questions there. Just want to throw it out to some of the mine workers who are on the call or their families, if anybody wants to talk about, their experiences. I'm very grateful. When I started this 7 years ago now, started talking to miners and doing some research and then went public with it. There have been dozens of miners that I've spoken to who have died and their voices are lost. And I really appreciate the ones who have come forward, even the ones who, didn't have health issues and they just wanted to contribute their information to OCAL, to just be able to help the next guy is what a lot of them said. So if there's anybody here, don't be shy. You just have to unmute yourself at the bottom. You'll see a little microphone. If you bring your cursor down to the bottom, it'll say mute or unmute. And if it's got the red line across it, you're muted, and just unmute and be happy to hear from you.
Hi, Janice. It's Terry Byberg here.
Hi, Terry. Nice to hear your voice.
Yeah, I was at Campbell from 72 to 79 when we were putting the McIntyre powder in. I don't think any visitors were ever going down early. So they would have come in after the miners were down. The McIntyre powder was, we were told that it was supposed to coat the hairs in your throat and your nose so that you would constantly cough during the day and expel the silica that you are supposedly breathing in underground. And that was the reason we took it. So
Any choice in the matter?
no, it was mandated, but it was for our own health, we thought.
What do you think now?
Well, I think the silicosis was due to poor ventilation, because once we dropped it, we just made sure we had ventilation in all the headings and nobody else got silicosis that I'm aware of. And now I'm getting worse and worse.
Thank you I think I've been hearing these stories for a long time, and I carry a weight of it with me, because especially when we've lost them, because I feel like I'm the person that has to tell those stories, and I think they need to hear it from somebody beyond me, and I appreciate that you stepped up, especially being the first one. Nobody wants to be the first one to go, so thank you. If anyone else wants to add in, please go ahead.
Hi, Janice. It's Wayne. You and I have talked quite a bit lately.
We have.
And for everybody else in the room, I didn't know anything about Janice. I just happened to find a report online, and I think it was the CBC's report, or W5.
That's the one.
And I then discussed with my father, because my father, I knew that he had worked in Elliott Lake when he came over from Britain. And I said, did you ever have to do this stuff? And he said, oh yeah, I remember that. He says, we used to hack it up like crazy. And he just, he said, we had no choice. It was either you do that or you don't work. You don't work that day. So he says, we just had to do it. And he says, if you did a double shift, you got a double dose. You know, you go down and you come up, and then you go back down and you get another dose. So he said it was mandatory. So I said, well, you know, I explained to my father that, you know, well, this stuff is, my father had gotten Parkinson's. He has passed away now since November. For everybody else in the room, just so you know a little bit of the history with me. But he had Parkinson's, and he died of end-stage Parkinson's. And Parkinson's doesn't run in his family at all, and nor does it run in my mother's side, and nor does it run in any of his relatives. So I said to Dad, well, how could you have gotten Parkinson's then? It's got to be this. There's no other way that you could have gotten it. And so he says, well, you know, you go ahead and do what you want to do. But he thought that it wasn't going to be amounting to much. He says that you're dealing with government and a big conglomerate. And he said, nothing will probably come to light because you're a little mouse against Goliath. And I said, well, I don't know, Dad. There's this woman, Janice Martell, that she's really going for it. And I think I like to support that. So I said, you need to make a first step. So with Janice's help, it really helped because, you know, Dad's voice was heard. And it was important. It really was. And I thank you, Janice, for that. And thank you all for working for this, because you're the voice of my father now.
And the voice of mine, Wayne. I'm here in an OCAL capacity, and I'm trying to keep my composure. But I hear all of you. I see all of you. I know what you've gone through. And your father's story really hit me hard because, you know, I think it's really important that we give these minors the answers while they are alive to let old men die with the knowledge that what they went through at work, you know.
Yeah.
Yeah. So anyways, I feel you, and I'm very sorry for your dad's loss, for your loss of your dad.
But, you know, just know that there's people out there that support you. I know I do 100%. And, you know, I'm there for you, and I feel for you, and thank God for you guys. Because nobody would have heard anything, and we never would have gotten this far had it not been for your efforts, your initial input. You know, look what it's grown to, Janice, and good on you for it. You know, if it wasn't for you, none of this would have been here today. And, you know, it's kind of like a final say for my father. And unfortunately, he wasn't here to get the verdict from WSIB, who have just recently recognized that, yes, Parkinson's was caused from McIntyre Powder, and yes, his COPD and lung disease was caused by this. So it was a long, long haul, and a lot of prove it, but with your support, we got there. And it would have never have happened without you, Janice, and I thank you for that.
Well, I thank you, and I feel much the same. I could have stood, like I say, I'd be spitting in the wind if people hadn't come forward. And I know it's hard to come forward and say this is what's happened to me, but people did. People are on this call who did. You know, hundreds of people came forward and their families, and it's tough. But by standing together and showing that there's this many health issues among this group, that's what occupational disease clusters are. You're really, you know, there's all these isolated people who, after they retire, often is when you see occupational diseases showing up. And, you know, they may not be in touch with their unions anymore. They may not know that something that they were exposed to 20 or 30 years ago may be causing what they are experiencing now. And it's a very isolating thing. And they're like, for Elliott Lake workers, their minds are closed. And, you know, who do you contact? How do you start this? So everybody who stood up, you know, mine workers first, my dad first, to give me the blessing to tell his story. but then all of the workers that stood up, and then, you know, that's why OCAL got involved. That's why the union really said, hey, what's going on here, and gave their support behind it. Not that they weren't supporting in the past by trying to fight this, but it's really, really important that we track what workers are exposed to and follow up with them years later and capture the stories while they are alive, because you're the voices for the people who are no longer here, as you know. So I am very grateful to OCAL and steelworkers and everybody who's carried this forward, but first and foremost to the families who came forward. That made the difference. So thank you very much, Wayne, for making me cry today. I thought it'd be the one thing that I could get through it without crying. So
it's still very raw for me. It's still very new.
Of course.
And you know, all I can say is to all the others who are out there, they're still fighting for this, to get a recognition from WSIB and all that. Just keep going, hang in there. It's an uphill battle with these guys, but they have to. The government has to know that you did wrong, and then you need to make a wrong right. So that's my piece. Thanks very much.
Thank you very much, Wayne. Anybody else want to jump in?
Jump in there.
Just very good meeting.
Sorry, is someone wanting to add something in?
Are you still on the line, Janice?
Yep.
Well, I'll add something to that. Yeah,
Sure.
I was part of your study there a couple of years ago. I'm John.
Kirkland Lake, I remember you.
Pardon me?
I said Kirkland Lake, you're from Virginia Town, right?
Yes, I am.
I remember you.
Yeah, okay, thanks, Janice. I remember you too. And, you know, referring to your last caller there, when he was saying that back in the day, when you got dressed, you know, and that's the honest truth. Like, you know, you went into the dry and you took down your basket, and they basically locked you in there, like close the windows and close the doors. And if you wanted to exit from that dry, well, they would just tell you that, well, if you leave the dry, you know. So a lot of these people had no choice but to sit there and inhale this thing. Your hands were black just from taking your chain down just to get to your clothes. So you can imagine, you know, what you were breathing in, really, you know, prior to your shift, prior to going down underground, and you know, being exposed to silica dust and this and what have you, whatever. It was friggin' horrible. And I've seen my father-in-law go from, you know, we talk about you have to be strong and healthy, and I seen my father-in-law and my brother-in-law go from, you know, being just that type of a person, even being able to feed themselves. You know, it's that I've seen over the years, you know, have passed away of Parkinson's and Alzheimer's, and you know, big strong guys like it. And you know, the industry should be ashamed of themselves for having exposed the people to this type of, you know. And myself, I was exposed to it for 18 years, so I don't know what the heck's going to happen in the future. But I'm, you know, I'm sure glad that you know, you guys are going ahead with this and trying to find what the heck is going to, you know, what's going to come out of this, like, you know. So I thank you, and I feel bad for all the guys out there that have been exposed to this, and their mom and dads and this and that and what have you. You know, it was horrible. They ban aluminum cooking utensils, you know, because of that same exposure to aluminum dust. You know, it goes in your body, it never leaves you. And that's all I have to say about it. You know, oh, one more thing. Let's not forget that a lot of the companies own a doctor. So, you know, when we talk about silicosis and this and that, So you can imagine what kind of prognosis that. That's all I'm going to say on it, because you know, it's still kind of a hard thing to swallow when, you know, when I see a lot of the guys that I've worked with over the years, and I've been in it for, you know, since '72. I retired 10 years ago. But, you know, I think I still have most of my senses, but who knows what's going to happen in, you know, 10 years from now, you know. So anyway, keep up the work, Janice, and your crew, and I hope that you guys, you know, come out. I'll call it a disaster anyway. So anyway, thanks, Janice.
Thanks, John. And you know, I'll still be doing this 10 years from now, so I hope that you stay healthy for the rest of your life. But if anything happens, you let us know, and we'll help you out as best as we can. I do see that there's one question in the chat saying, is it possible for spouses to have contracted side effects from the powder? I don't know if anyone can speak to that.
If nobody else is, I guess I could. I don't think so. In fact, I mean, the whole challenge with this McIntyre powder is that people had to breathe it deep into their lungs, and it was very fine dust. And then they went to work afterwards. So I would think, unlike something like asbestos, I would think that there wouldn't be a lot of risk to family members. Certainly not much compared to the workers who had to breathe the dust very deep into their lungs and continue doing it for quite a while before going into the mines.
Thanks, I appreciate that. I had something from on the Facebook feed just saying she'd like to be able to speak but can't figure out how to mute Dorothy. I don't know if Dorothy is on the actual call, and I don't see her here. Anybody else have anything that they'd like to share?
Well, maybe I should comment on management. It's easy to sit and say that this is a despicable disease and it was caused by mining. Back then, the management thought that this was the best thing for people working in the gold mines, to prevent them from having silicosis. So that's the reason they pushed it. I mean, Campbell was one of the last ones to come off the grid, you know, to stop using it. And that was mainly because CBC came in and did an article on the mine. Came in under alternative, what the heck do you call now? Just they came in saying they're gonna talk to the people and just do an article on the mine. Well, they came in for a specific reason. And the papers, the manager then said, all right, we're gonna stop it. But up till that point, he had firmly believed that it was the best thing for us.
I can say from the research that I did that it was mining executives basically at McIntyre Porcupine Mine that brought this in, and that there was some pressure on the mines that to show that they were using the aluminum dust for in terms of silicosis rates and stuff, and that the health and safety people, they were all told this has been tested, it's been proven beyond a doubt. If you look at the McIntyre Research Foundation's records, and the McIntyre Research Foundation was mining executives basically at McIntyre Porcupine Mine and a couple of industry doctors. And if you look at their records, they really promoted this quite blindly to, not blindly, quite exclusively promoted it to everyone. They had a lot of control over who was saying anything about it. If you wanted to publish anything about McIntyre powder, you had to bring it to their review before you published it. There was a lot of that kind of thing. So some of the guys who talked to me said, I put this in the mining, I was a student, my summer student, and this is what I was doing. I was giving aluminum dust to the guys, and they feel really guilty and horribly, and I have no blame whatsoever to them, because for them, this is what they were told to do, and they were all told, the unions were told, everybody, that this was going to save you from silicosis. Breathe deep, boys. So whatever ill will I have, it is not towards towards the people who were dealing with it on a daily basis. They were told that it was this is what you do. So yeah. Anyway, that's my 2 cents, and I will see if there's anybody else who wants to speak. Thanks for speaking up, Terry.
Janice, I just want to say I was very fortunate in that I did not get any long-term exposure to the powder. I remember one occurrence, and that's why I contacted you some time ago about it. So I was very fortunate in that. But I think the broader question here that's being brought up is that forever being diligent around ideas coming up from the companies around health and safety. I think of x-rays. I was one of those people in the mining industry who had to go for an annual x-ray. Now we know that's not good for us. We stopped that. So we have to be forever diligent when it comes to these things. Yes, the management of the time did not do what they did. We have to believe they didn't do it as callously as some may say. But we still have to be asking the questions. I think that's where labor unions really come to the forefront. They ask the questions, they probe, just like you did in this study. So I think it's imperative the overlying theme here is that we can't just blindly walk into these things and think it's the right course of action. We need to ask the questions. And that goes for management as well.
I have a question. I'm wondering if Dr. Demers is interested in going through his files once again and finding out how few times you had to be exposed to this to have your Parkinson problems or develop Parkinson's. And there's no family history of Parkinson's. And she was an office worker that did go underground on occasion.
The type of research that we do is really the kind that isn't really where we focus on individuals. For that, it's a very different kind of study. Really, what we are trying to do is, in order to do this kind of work that I do, is look at large numbers of people and look at the patterns there, particularly when we're trying to look back in history and it's hard to recreate what had happened. So I'm afraid it would be very hard for me to be able to say anything about a specific individual and how little or how much it would take for them to become ill. It's just not something that I'm able to study, so I'm sorry.
So just before Dr. Demers has to run out, he's got an appointment. I know we're running over time. Thank you very, very much for giving us your time so generously to this. If people want to stay on, maybe we could stretch it till 3 o'clock for the rest of us if people want to continue to share, and if not, we can wind her down. Thanks. Thanks, Paul.
Thanks for having me, and thanks for listening, everybody.
Hello.
Go ahead.
Yeah, Lester Cudmore. Janice, I want to thank you very much. I've been born and raised in Timmins, and I've watched a lot of the miners suffer through the years, and it's sad, but we can't go back in history. What you're doing now is trying to right the wrongs that were done in the past, and I applaud you and the group for that. For I don't know if Dr. Demers is gone, but I don't know if they did any studies. There's such a thing as an updraft and a downdraft shaft. And if it's an updraft shaft, that means all the contaminated air with the aluminum dust is coming up into the head frame, into the office area. So that might be a little more study work on that area if that wasn't looked into. It's very important that that you look into that fact with that. And the other is, my dad worked at the Palmore mine, ran the group from 1942 to 1982, and he contacted Parkinson's, and he worked for a number of years with the Parkinson's, hiding it because there was no long-term insurance. There was nothing there for the miner, and these poor people had to suffer and go to work every day, hide as much as they can or could, so that they could maintain a livelihood for their family. And it's sad, but thank God for occupational health and safety today that has eliminated a lot of this fear for the workers.
Things that we really need to move forward that I didn't really put on my slide is that to give this feedback to physicians, to nurses, you know, occupational health nurses. People have now been saying that they're being asked about their occupations, and that always, no blame on, you know, physicians and nurses and stuff, because I know how busy they are, but it needs to be incorporated, similar to when you ask, you know, history of other things, you know, high blood pressure, smoking, that kind of thing. Figuring out, we spend, you know, most of our adult lives at work. So finding out what we're exposed to is really important, and that's starting to get back there. And OCOW is doing some work trying, you know, to reach out from our physicians to family physicians, primary care physicians, and providing them with that information so that they can see that this isn't, you know, that there are real links here. So I'm really glad to see that that's starting to trickle back and getting some referrals from the medical community as well. Anybody else? Really appreciate everyone coming out today, sticking with us. We will, there's a short survey that you'll see in the chat, and it should be sent to you to your email as well. Just to say, you know, we're a nonprofit, and just to be able to report to our funders that, you know, this was a value to you. We really appreciate you, you know, completing that survey, and certainly hearing your voices and having other people hear your voices was really important today. And I'm getting lots of comments about how much people appreciated that. And thank you. It's very grounding for the people who fight for you.